Yeah, so as you mentioned, I'm going to be presenting the preliminary results from a pilot study. The study was actually designed to look at a total of 10 patients. We're going to be doing focused ultrasound ablation using the Philips Sonaleave machine. We're looking at pain and quality of life scales, so we're using a validated age-specific pain tools, as well as quality of life and drug use surveys. The inclusion criteria include patients who are 5 to 17 years old, less than 140 kilograms with a typical signs and symptoms of osteoid osteoma or biopsy-proven osteoid osteoma. The pain must be greater than moderate or greater than 4, and the lesions must be acoustically accessible. Exclusion criteria include the inability to localize the pain, pregnant and nursing mothers, centrally located lesions, and significant comorbidities. This is an overview of the study protocol. So basically, patients are brought into the study. We do pre-procedure imaging. Following the procedure, we follow up with phone calls for the first 14 days afterwards. At 30, 90, and 180 days, we bring the patients into a multidisciplinary clinic to see them personally. So between July of 2014 and May of 2016, we performed 7 procedures on 6 patients. 4 males and 2 females. Average age was 13 years and average weight was 52 kilos. During this time period, there were 20 patients that were referred for ablation. Interestingly, 2 of those actually had an incorrect diagnosis. 6 patients refused to take part. 6 lesions were considered non-accessible and 6 patients agreed to take part. The areas that we attempted to treat were femur, fibula, and calcaneus. 5 of the lesions were cortical and 1 was medullary. Looking at the treatment parameters, we did an average of 7 sonications per patient. We used an average power of 50 watts, and the total amount of energy that we deposited in our patients was just less than 8,500 joules. So we were kind of early in the learning curve, so it may be higher numbers than Dr. Napoli is using. The overall treatment length from first sonication to end, the last sonication was roughly about an hour. Looking at our admission times, our first patient took 8.5 hours of total admission time. The last patient was less than 4 hours. They were out of the hospital. So of the 7 procedures that we performed, we had an 86% technical success rate. I'll come to the 1 technical failure in a minute. Of the 5 patients that we performed procedures on, we had an 80% complete response rate, so they were pain-free and drug-free after the procedure. 1 patient, unfortunately, had only a partial response, and we had no significant adverse events during the procedure. So this is a graph of the pain scores before and after the procedure, and as you can see, there's a downward trend after the procedure is performed, with the average decreasing from 7.6 prior to the procedure to 1.7 after. The patient in the red and green here is the patient who didn't complete the response, and she kind of skews the data that you can see. I included time to fall asleep as an example of the type of quality of life data that we're completing. Again, the patient who did not completely respond is shown in red and kind of skews the data a little bit. But most of the patients indicated that they had a significant decrease in the time that it took them to fall asleep after the procedure was performed. This is an example of a typical cortical osteoid osteoma. On the left, you can see that there's significant contrast enhancement prior to the procedure. And this is one of the cases where, despite the fact that we did a fair amount of sonication on this patient, there was still some perfusion of the nidus afterwards. The patient has, however, been pain-free for about 2 years. And interestingly, on follow-up imaging, it does look that there is some remodeling going on. This is the patient that we had only partial success with. So this is a very large, very deep, very dense lesion. This is biopsy-proven osteoid osteoma. It's a very unusual looking lesion, but it is osteoid osteoma. And despite the fact that we aggressively treated this on 2 occasions, the patient did not completely respond. So she's actually indicated that she's having some increasing pain, so we're going to be treating her with cryoablation in the next couple of weeks. Now, this is the case of the technical failure, and this was a lesion located in the calcaneus. We knew that this was going to be tough technically to try to do. What we were hoping is that by positioning the foot and inverting the foot, that we would open the sinus tarsi up well enough to be able to perform the ablation, but unfortunately that just wasn't the case. When we did a very low power test shot, we actually saw some heating in the near field of the calcaneus. We had to abort the study. The patient 2 days later underwent successful laser cone beam guided CT ablation. So in conclusion, this is an effective method of treatment that reduces pain and improves quality of life. We had no significant adverse events. We've really kind of pushed the envelope for the types of patients that we brought into the study. I think in the future, patient selection is going to be very important for successful treatment. And the treatment parameters, I think we really need to look at those. And these are our disclosures. Thank you.
Thank you. Any questions? I do have a quick question. The case that really didn't want to respond, even with high power, it looks like very much the one I presented, because it's totally detached from the cortical space. So an intact cortex means not very much penetration of the energy, probably.
Exactly. And looking at it, the cortex actually looked a little bit thinned out, so we were hoping that we'd get good penetration. She did have some response to it, but it wasn't enough.
Yeah, we need to find a way to get the energy over there.
Yeah, and I hope that maybe lower frequencies or something will help us.
Or even longer sonication, much longer, probably. This is the way I'm doing now, and it seems to work, actually.
Okay, great.
Yeah. Okay, thank you very much.
Thank you.